Hello, my dear friends and colleagues. My name is Roni Moya. On behalf of the European Wellness Group, I welcome you to this amazing, beautiful event. Today, I'm talking from Portugal about cell therapy in neurodevelopment and neurodegeneration, and I hope you like it. Let's start with the regenerative medicine field, which is treating patients in order to regrow, repair, or replace damaged or diseased cells, organs, and tissues. In neuroregeneration, we have to start by separate our clients in two groups. First group would be the neurodevelopmental group. The second one would be the neurodegenerative group. In the first one, you place autism, Down syndrome, cerebral palsy, attention hyperactivity disorder. And the other group, you place the brain aging patients like Alzheimer's, Parkinson's, stroke, multiple sclerosis. And with the cell therapy, you aim in two parts. First, regeneration. Let's do everything that we can in order to regenerate. Second, immunomodulation. Immunity is important. Support immunity and diminish chronic inflammation is main in order to have neuroplasticity, new connection between neurons. So, why cell therapy? Because with cell therapy, you can stimulate, as I said, neuroplasticity. As you see here, we have a limited regenerative capacity of the central nervous system. So we have with the regenerative cell therapy target inflammation, apoptosis, synaptic dysfunctions in order to support also immunity and with the clinical goal of functional recovery and slowing the disease progression. So the cell therapy can be put in two groups. First group would be the stem cell therapy when we use young cells, multi or pluripotent cells in order to regenerate the tissues. The other part would be the immunotherapy, the use of cells and their molecules to regulate and modulate immunity. So let's start with the first part of the stem cell therapy, which is xenogenic cell therapy. That is using animals, fetus sources to treat human beings. The therapy with animals have been studied for a long time already. We have several articles and books, and the animals are safe and their cells are purified in order to treat human beings without any problems, without any rejection. So, ovine, like sheep or rabbits, could be the source of those precursor stem cells therapy that are the most concentrated cells ever. Fresh cells, 1.6 billion cells coming from the sheep fetus or rabbit fetus in order to have a paracrine effects, which means that one cell can trigger the other cells by releasing their young substances to induce neurogenesis. With this homing process, which means bioidenticity, the cell from the sheep can recognize the cell from the human being. You can personalize the therapy. You can target specifically the organ you want to treat. So the advantages here versus the adult stem cells is that you have a faster differentiation, you have a higher adaptability and survival of the cells, and minimal immunogenicity as they are bioidentical. The precursor stem cells therapy is the most active therapy you can have, the most individualized, personalized. You have to choose the organs that you want to treat, like I'm showing here. For example, you have the neurodevelopmental disorder or neurodegenerative disorder, the cortex, the brain cortex, that's very important. Or if you want to enhance memory, you can choose hippocampus. If you want to regenerate coordination, cerebellum, or mood, amygdala, or support immunity, thymus, and the spleen or mesenchyme. For example, in multiple sclerosis, you can choose a spinal cord or cauda equina. For Parkinson's and motor spasticity or stiffness, you can choose basal ganglia. Do you understand what I'm telling you? So, with those precursor stem cells therapy, the fetal cells from the animals can target a specific the organ that you want to treat, and by a higher concentration that you can have, you will have a better efficiency of results. Let's see here a kind of example with the cerebral palsy when you choose by different symptoms of this kind of patients. For example, ataxia, dyskinetic, spasticity. So, for example, you have the periventricular cells, medulla alba, parietal lobe, cerebellum. That is the beauty of the xenogenic cell therapy. With the classic stem cells, you cannot differentiate the cells. With that, you can. And that is the best therapy that you can have. For example, there's another patient for attention deficiency, and here, see, you can choose the holy brain and all the lobes that has the special functions like a frontal lobe, temporal lobe, a parietal lobe, occipital lobe, even the brain stem, cerebellum, hemisphere, the whole hemisphere, or and thymus for immunity support. So see, you can mix up the kind of organs that you want, you can integrate the cells, and you can have for sure a better result of the therapy. As you understood the precursor stem cell therapy, which is the most concentrated fresh stem cells, you can understand also the next level, which is the frozen organocryogenics. Those specific cryopreserved xenogenic cell factors they have the capacity for regeneration with the vial ready to be used by intramuscular injection with 100 million cells. The precursor stem cells therapy, which is more concentrated, stronger, is also by appliance with intramuscular injection. So all those tissues that are stronger, they have to be applied with the intramuscular injection. But you can choose several different organs, and the idea with the frozen organelle is that they are already ready to be used. They are not so personalized as the first one, that you can order specific to your patient. We can also, as group, discuss the kind of better organ that you can use to your patient, so on. And with these, you have the menu, you have the cocktails with several kinds of tissues in one vial, or individual vials. With those vials, you can organize the protocol you want to perform. For example, for brain, you can have the CNS, the brain, hippocampus, cortex, everything is together with the CNS. The thymus is spleen for autoimmune and neuroimmune disease, placenta, adrenal, for anti-aging and stress resilience. So you find very interesting use with the frozen organelle cryogenic, because it's easier to get and easier also to apply. And there is another level. This level is one of the best, second my point of view, which is the peptides. Peptides are small parts of cells, proteins that communicate between cells. They release the transfer factors and all the nutrients and components of a young cells in order to regulate the regeneration. So here we have specifically the mitochondria peptides. So mitochondria-derived peptides are the small mitochondria from any organ that you can choose, and those mitochondrial peptides can regulate, as you know, the ATP, the metabolism, energy, the apoptosis regulation. They have anti-inflammatory effects, reduction of oxidative stress, and they can regulate and repair the regeneration. So in this example I'm showing you here, I have a mitochondrial-derived peptide that can be applied sublingually, subcutaneous, intravenously, even topically, because they are very small molecules and very well absorbed. They have cocktails of vials, and I like to choose the one specific called male or female revitalization. These cocktails have 12 tissues, as I say here: brain, heart, liver, placenta, spleen, thymus, mesenchyme, fetale, totalis, adrenal cortex, testes for men, and ovary for women, bone, joints, cartilage, and synovia. This cocktail of 12 tissues is the best one to regenerate overall. So, if you have a neurodegenerative patient or neurodevelopmental patient or even other kind of patient, you can use this cocktail to regenerate all the body. That's beauty. That's beauty. Imagine that you can use frozen cells, precursor stem cells, mitochondrial-derived peptides in just one integrated therapy. You can do all. Let's see the practical summary. Which product and when? For sure, if you want to start with chronic conditions with the best therapy, you choose the precursor stem cell therapy. They are more concentrated, and you can individualize the organ by order the tissue that you want specific to your patient. Of course, you have the ready to be used, the cryogenic, frozen organocryogenic cells, and those cells are already prepared to be applied intramuscularly. They are not so strong as the precursor stem cells, but they are pretty strong, and they can be applied anywhere you want. It's easy. So you have that for as main therapy for every disease. And then you have the peptides, either peptides that are frozen or mitochondrial peptides that come already in the vial in liquid, ready to be used. Those therapies with peptides are maintenance therapy or adjunct therapy. They can be added to the frozen or the precursor stem cells therapy. Here you have the aging brain as the frozen cells more advisable comparing to the precursor stem cells, because this is more subjective. With the aging brain, you can choose a different kind of frozen cells and peptides, and you can apply. It's easier than do with the precursor stem cells therapy. So let's jump to the allogenic therapy. Allogenic, you have a donor, a healthy donor to the sick receptor. And the one that's most recognizable as stem cells is the mesenchymal stem cells coming from the umbilical cord. Depending on the country and on the law, you can use the umbilical cord from a healthy donor that is already purified, that had been already purified into the lab in order to not induce immunogenicity to the receptor. So those hundreds of millions of cells from the umbilical cord, they have a very extreme regenerative potential. They can differentiate into the body. They have the mesodermal lineage to be developed, and low immunogenicity, and also good immunomodulation. The tissue repairing, the anti-inflammatory effects, the long-term safety, it's pretty known with the use of the mesenchymal stem cells from the umbilical cord. But as I told you, depending on the country, the umbilical cord can be integrated with the xenogenic cells, because the umbilical cord, you don't know exactly the organ. It's just a whole differentiation, and therefore it's going to do its thing. But with the xenogenic, you know the organ. That's the difference, and then you can add up. And after you have the one that is the training of the anti-aging and regenerative medicine that calls exosomes or exosomes derived from mesenchymal stem cells. Exosomes are nanovesicles that are released from a young stem cells to the other cells in order to deliver all the nutrients and regenerative components and so regenerating the old cells. And the good of the exosomes is that they have a good immunomodulatory property, anti-apoptotic, and also cross the brain-blood barrier, delivering the proteins and the RNAs and all the vitamins. They are very good for Alzheimer's disease into the synaptic repair and memory, stroke for infarct reduction, and multiple sclerosis for remyelinization. And as you see here, it's good for immunity, autoimmunity, cancer, fight infections, and even for other kind of therapies like orthopedics. So pay attention. Remember, exosomes you have to integrate in your regenerative therapy. Let's speak about immune therapies, the source of the support for the neurodegeneration. The one that I like most is the CAR natural killer cells, because the natural killers are the first cells to approach the system and fight disease. The natural killer cells can be changed into the lab from a healthy donor in order to develop immunity against disease and also modulate autoimmunity and stimulate regeneration. The natural killer cells, they have to be collected and isolated from a healthy donor, therefore activated and expanded in the lab, engineered and specific and have the specification to destroy the disease that you want, and therefore cryopreserved and administered by intravenous several infusions. It's hard to apply the CAR NK cells because nor even all the countries can have access to that, and these are an expensive therapy. But I have a solution. If you don't want or you can't do the CAR NK cells, you have the autologous active specific immunotherapy, a very good personalized therapy coming from the blood of your patient, and you can perform that on your practice. You just have to collect the blood, you have to isolate the buffy coat, or either from the blood or from the tumor or other part. We are speaking about a neurodegeneration, so it's blood, and then the lab will bring to the machines the blood and will expand and immune activate the cells in order to develop a vaccine, an immunotherapy individualized to your patient to be applied subcutaneously 3 times per week. It's pretty easy. The patients themselves can do it. Normally, there are 30 vials of the AASI to be applied 3 times per week subcutaneously. Can be integrated with the other stem cells and peptides. So let's see how it's done. Where you are at your clinic, you take the blood, and then you pick up a little bit of the serum. You separate the buffy coat, as you can see here. You put into the serum where is the tube. So you have the buffy coat, the serum. The lab will produce the vaccine, and your patient will apply subcutaneously 3 times per week. The other immunotherapy that you can find is the GCMAF therapy, granulocyte protein-derived macrophage activating factors, which are macrophages coming from the colostrum, calf colostrum, with hyaluronic acid to be released slowly into the system. Those macrophages are already activated to diminish one very important enzyme called nagalase. Nagalase is an enzyme that is immunosuppressant. It takes off the activation of the immunity. So those macrophages will diminish the nagalase and therefore expand the immune system to be alert against infections and diseases. The GCMAF is pretty important and famous to fight cancer and also to induce neurogenesis. And the application is pretty easy also, like ASI, is to be applied subcutaneously, but this time once per week, and can be integrated with the AASI. So in order for you to have the best immunomodulation, you can put AASI, GCMF, and the cells, for example, thymus, spleen, mesenchyme. Can you imagine how beauty is to treat your patient with those kind of tools? So I want to speak about autologous therapy. Okay, there are several kinds of cells that you can pick up from your patients: peripheral blood cells, adipocyte stem cells, skin stem cells, different kind of cells, even bone marrow or cartilage. But I prefer to do a systemic therapy, the adipocyte-derived stem cells. You see here the pellet, 200 million stem cells coming from the fat of the patient. The problem here, you have to do a lipo. It's a small surgery. From the lipo, you have the fat, and you have to fulfill a protocol, international protocol, to purify from the fat the stem cells. With these stem cells, you can work in medicine by applying intravenously to your patient in order for them to develop regeneration. This is I have an advantage here with that, because anyone that has a little bit fat can have stem cells. Those stem cells can be preserved from the fetus age until 90 years old, because in the fat you can preserve those kind of cells. Um, with the therapy of the fat cells, I like to also separate some leukocyte-rich um, plasma cells. These kind of cells that you can find in the plasma also have a property of regeneration and immunomodulation. And what I do, I put the fat stem cells in an IV therapy together with the exosomes and also with the plasma-rich leukocytes. And I do by showing you like that. I separate the plasma, then I activate the plasma, I filter the plasma, stimulate with light, green, red, and then I put exosomes and push into an infusion. These three kinds of stem cells, exosomes, plasma, and adipocyte, can be strong together by being pushed into an infusion with another supporting therapy that I'm going to show you afterwards, with antioxidants and multi-light therapy. So, if you see the comparative table here, you look to the source of the therapy, for example, the PSCT or the frozen cells or the peptides or the exosomes or the umbilical cord, the mesenchymal stem cells, natural killers, GCMAF, AASI. You have the sources, as I told you. You have them, all of them has a minimal or known immunogenicity, but they have a good related regeneration effect. So you have the advantage of the precursor stem cells here with the high plasticity targeted organs. You have the frozen cells that are stable, cryopreserved organs. You have the convenience of the peptides is to store and administer. You have the exosomes with a good possibility of immunomodulation and crossing the brain-blood barriers, and so forth and so on. So if you integrate these kind of therapies, you have a better result for sure. And let's see the clinical algorithm. Step one, two, and three. First step is to separate the group, neurodevelopmental or neurodegenerative, as an aging-related cognitive decline. And the step two is to identify the targets in order for you afterwards to choose the tissues. So inflammation, autoimmunity, neuronal loss, mitochondrial dysfunction, neuroendocrine dysregulation. You will organize your mind to see which kind of target you want to achieve. And there you have the organs, you have to choose the tissues, CNS, thymus, spleen, pituitary, adrenal, placenta, whatever. And when you choose everything, then you choose the product, precursor stem cell therapy, umbilical cord mesenchymal stem cells from adipocytes, exosomes, frozen, mitochondria, AASI, natural killers, GCMAF. You can put all together or individualize the therapy. And by the ending of the day, you want to understand which kind of plan of administration. For sure, precursor stem cells, frozen cells is intramuscularly, umbilical cord intravenous, and then you will see the cycles of the therapy and the follow-up, which kind of functional scales, inquiries, imaging labs you want to put to understand the results of your clients. By telling you that, let me show you the supporting therapies. Always in a session of stem cell therapy, I perform infusions because the antioxidants can support the cells and enhance their potentials. So in my infusions, I always put vitamin C, mineral pools, full of amino acids with high dosage of glutathione, glutamine, arginine, lysine, cysteine, and I do also push also alpha lipoic acid, complex B, NADH, in order to activate oxygen, ATP, and energy. These infusions are mandatory if you want to work with cell therapy. You will see a real better result with that. And by the ending of the therapy, what I do is multi-light infusions. You know that cells and even the antioxidants are sensitive to light and color. So by doing the infusions with laser therapy, low-level laser therapy, I can activate by color the cells and the vitamins, and I can fix the differentiation to regenerate the organs better. Let's now see how I do in one session. Of course, you can do a lot of things in just one session, or you can divide the therapies. For example, you can do frozen cells in one therapy, other day immunotherapy, other day fat stem cells. But what I do is to try to put everything together in 3 hours therapy so the patient can travel, can do everything in one day, and therefore continue with the peptides therapy, immunotherapy at home, because those are subcutaneous or even sublingually applied. So let's see the full regeneration therapy. Here you have the blood taking, the fat taking, and then the process of the fat to achieve the activation of the stem cells. Here you see the stem cells, the infusions, and afterwards the infusion of the stem cells, light, precursor stem cells, frozen stem cells, AASI, GCMAF, everything applied in one session, and therefore the patient will continue with the therapy of maintenance at home. So, clinical cases. Let's jump now to the clinical cases. This is a very interesting clinical case of a patient of mine who entered in a coma and couldn't wake up anymore. So the mother brought the mitochondria-derived peptides to the hospital and applied subcutaneously on her daughter. And the day after the application of the mitochondria peptides, the patient just woke up, as you see here. The peptides I worked with was the peptides for brain, CNS, just that. Okay, so with that kind of peptide, October 11, 2023, she woke up, and therefore I applied when she could receive injection by intramuscular. I pushed the frozen cells from pineal gland to stimulate the circadian rhythm and neuroendocrine balance, and then also together with the pineal gland, I applied revitalization, the feminine revitalization. Okay, so these, remember, 12 tissues in order to regenerate the whole system. When she could develop a little bit more, then I'll apply the exosomes, PRP from the blood, and more frozen cells from brain and thymus. See, this was October, and now December, January, and April. You can see during the sessions the regeneration of the patient, and pretty fast, as you can see. She was woke up with ataxia and then woke up from the chair, walking, practicing exercises, and driving. Here you see her walking and already speaking. So she's walking better. Look how she's walking. And now she's talking. My name is Joanna. She's articulating the speech. And this is the written, the graphics before and afterwards. It's pretty amazing what we can achieve with a mixed up of cell therapy. This is a kid I started to work when he was pretty young, like 6 or 7 years old, a vegetable, couldn't respond to anything. And then I started with the frozen cells and mitochondria peptides until I achieved the umbilical cord mesenchymal stem cells therapy, and integrated with the frozen cells from brain, lungs, thymus, and autonomous peripheral nervous system. This is a different kind of patient, several sessions, but from a vegetable to I could in 2023 see the first steps and kind of expressions in the face of this kid. And of course, now you see the physical therapy. He is able to drive the bicycle alone and bringing happiness to the family. And last week, I just applied another FOC of lungs because mitochondrial disease has a problem in the lungs, you know already, and also brain. And now he is walking better. He is articulating better. He's 15 years old now. And this is the follow up of several years doing sessions of cell therapy. And here you see another client of mine who has ataxia, cerebellar ataxia, stiffness, couldn't move, couldn't walk, couldn't shower herself. And then I worked the first session with the frozen cells for brain, 2 vials, female revitalization, peripheral nervous system. And another session, I did the mesenchymal stem cells from adipocytes, exosomes, and PRP, and the other sessions more frozen cells. So after the first session of the frozen cells, she could already take a shower, and she's speaking that before the injection she couldn't do nothing, she couldn't raise the arms, and now, as you can see, she can raise her arms and have more balance. And after the second sessions of the stem cells, when I did the frozen cells with the adipocyte mesenchymal stem cells, she could walk better and she could write better. Look the graphics of this person. This was before how she could write, and now what's it's an amazing therapy, see. And the better thing is, after she could walk better and faster, she could raise up from the chair easier, and she could walk, she could speak with us about her progress. And one of the most interesting thing of this patient and is that she's cleaning, she's cooking, she's having movement, and she is happy. Most of all, she's happy. Let's see her walking out from the clinic last week. Look how fast and easy she is going with her husband, who is also a doctor and trusts a lot in the stem cells therapy. Look how fast she's going. Steps and going on pretty easy. It's amazing, people. So that's the patient that I started to treat with Alzheimer's in 2024. What I did was frozen cells, brain, pineal, female revitalization, and the PRP, exosomes, and adipocyte mesenchymal stem cells. The session that I showed you that I do in one day. So this is her before, stiff, like kind of complex movements were like difficult for her to do. And now here, the person already taking orders and also dancing. See, she was dancing. I want to show you again. Look. And before that, she was taking orders from me. Like I was telling her, raising the arms, doing that, and she is responding my command. It's an amazing people. This here is another person, Alzheimer's, that I'm treating from 12 until 24. He's 90 years old. He had stroke and Alzheimer's. I did umbilical mesenchymal stem cells, not a fat, because he's old. I didn't want to do lipo. Exosomes, frozen cells, brain, hypothalamus, pineal, hypophysis, and brain cells every 3 months during all the years. Okay. And now, with 90 years old, he's speaking, he's driving a car nearby, he remembers the name of the wife, and I'm here in Portuguese asking him how he's feeling and if he remembers the name of the wife and so on. Look a little bit of what he says. See, he's very active and alert to my asking, to my questions. So that's what you can achieve, my friends. We write a lot of articles, we publish science, we practice what we teach. We are always teaching you. We are happy to help you all the time. Our group is strong. We keep as family. We work with a lot of publications, books. This is one of us, Professor Dr. Mike, Professor Dr. Dimitro, and me with immunotherapy. The other ones in cell therapy. We have several publications and also hundreds of books and also success stories and testimonials. Okay, not just mine but all the group has. We have a lot of people. You can see thousands of people happy from our therapies. So I hope you liked the conference. If you want, you can contact me. Let's exceeding the limits, disrupt regenerative biomedicine. I appreciate your presence. Thank you very much. Enjoy the event. Bye bye.